welcome to our tutorial series on evaluation. In our today's session, as promised in the first and second part of the tutorial series on evaluation, we will discuss how to develop evaluation framework with components of evaluation and UNEG DAC evaluation criteria. And also will give practical examples of evaluation in different sectors. In the part 1, we discussed fundamentals of evaluation, why evaluation is important and what are the various types of evaluation, and we also provided some practical examples of evaluation in different sectors. Similarly, in the second part, we discussed key components of evaluation like evaluation criteria, evaluation questions, data collection methods, data analysis and reporting, how to conduct evaluation while applying these components and criteria. These tutorials have been uploaded on YouTube. The links are given in the description if you haven't watched them. Let's start with our today's session. Don't forget to subscribe, like, share with your family and friends, and hit the notification bell. In this part 3, we will discuss how to develop evaluation framework with components of evaluation and UNEG DAC evaluation criteria, and will also give you some practical examples of evaluation in different. When you are starting in evaluation, so you need to develop evaluation framework. If there is a project, so how you will need to develop the evaluation framework. That evaluation framework will have all those components: evaluation criteria, evaluation questions, data collection methods, data analysis plans, and then reporting and communication. Now on this slide, I don't know it's visible to you or not, but in each slide I will show you each component. But here I am just showing you on one slide. Here you can see the UNEG criteria. Then what could be the evaluation questions? What would be the data collection method, data analysis plan, and roles and responsibility. This is an example of evaluation matrix. Let's discuss each one in detail. So evaluation framework matrix, for example, improved health status of population in rural area. This is a project, improved health status of population in rural area. We are developing an evaluation framework for that. So the first one, as I showed you in the table, the evaluation criteria is the relevance. So for this, our evaluation questions would be like these. Does the project address the key health needs and priorities of the rural population? That would be the key question. How well does the project align with local health policies and strategies? Data collection method would be stakeholder interview, community surveys, policy document reviews. Then in data analysis plan, we will do thematic analysis of interviews and survey data, qualitative data, and comparison with local health policies. We can have some analysis of the responses from the community surveys also. So that is also a player of data analysis. And then responsibility, that would be evaluation lead, oversee relevance assessment, field researchers, and policy analyst, etc. So here you can see the roles and responsibilities of the different team members. This is the evaluation framework sample. First, criteria. Which one is the criteria? Then the evaluation question, data collection method, data analysis plan, and responsibility. Let's discuss now the next one, coherence. For coherence, our evaluation question would be how well does the project integrate with other local or regional health initiatives? Are there any conflicts or synergies with existing programs? What would be the data collection method? Program documentary, interviews with partner organizations, network analysis, the data analysis, thematic analysis of the project document, qualitative analysis, quantitative analysis, and here you can see the roles and responsibilities of the different team members. Effectiveness. Our question would be, to what extent have the project objectives and targets been achieved? What are the measurable changes in health outcome, for example, morbidity, mortality among the rural population? You can add a lot of other sub-questions. I will show you some other examples, but these are the key main questions. What would be the data collection? Health records, pre and post intervention survey, focus group discussion. These would be the data analysis plans, and here you can see the roles and responsibilities of the different team members. All this is related to this project. Okay. Similarly, for efficiency, how effectively have resources, financial, human time been used to achieve the project outcome? What is the cost effectiveness of the intervention? So here we will see financial records review, staff interviews, cost benefit analysis, and the data analysis plan would be cost effective analysis, thematic analysis of interviews, data, and financial analysis. And here you can see the roles and responsibilities of the different team members. Then for impact, our key question: what long-term changes in health status being observed in the target population? What unanticipated outcome, positive or negative, have emerged? Similarly, here you can see the different data collection methods: longitudinal health data analysis, community interviews, case studies. Here you can see data analysis plan, trend analysis of the health data, qualitative analysis of the community feedback, case study synthesis, etc. And here you can see the roles and responsibilities of the different team members that are required. And then for sustainability, how likely are the health benefits continue after the project ends? What mechanisms are in place to ensure the ongoing maintenance of the project outcomes? So this is the key question for sustainability. The data collection method would be follow-up surveys, interviews with local health officials, review of project documentation. This is the data analysis plan. You can add other areas also, other data analysis plans also, and here you can see roles and responsibility. So basically, this is a complete evaluation framework, just a framework for that project. And in these questions, then you can add sub-questions in the tools when you are developing detailed tools for data collection. So you can add a lot of different questions. So here I will show you some examples more of evaluation in different sectors as we discuss the evaluation framework. So now we will discuss examples of evaluation in different sectors with that evaluation framework. For example, you are evaluating a maternal health program in rural area of a country. Here you can see the evaluation question would be: how effective is in reducing maternal mortality rates? It's evaluating a maternal health program. So the key question for your evaluation is: how effective is the program in reducing maternal mortality rates? You can add then sub question that we will discuss now. Indicator: number of maternal deaths per 1000 live births. So when you are asking this type of question and when the is evaluating maternal health, so obviously your indicator would be number of maternal deaths per 1000 live births, percentage of births attended by skilled health personnel. This is also an example of indicator that you would need to evaluate if you are evaluating this project. Data collection method: health record analysis, surveys with program participant. You will conduct surveys and you will also analyze health records. Now criteria. The criteria that you will need to apply. The first one, relevance. Are the program activities aligned with the community's health needs? Your program is on maternal health program. Whether actually in that rural area their mothers are dying during giving birth to children or not, you can evaluate through these type of question. Are the program activity aligned with the community health needs? Efficiency: are resources used effectively to maximize health outcome? Effectiveness: has there been a reduction in maternal mortality rate? You have completed the project, so is there any reduction now? For example, if there was one death per 1000 live births, so now what is the status? Coherence: does the align with other health initiative in the area? If health department or other NGOs are conducting some activities in that area, whether these activities are aligned with those? Impact: what long-term health benefits have been observed? And similarly, can the community maintain the health practices after ends? Now when you conduct that evaluation, so what you will have to present? You will have to present the data analysis. So for example, there are different regions in that area, region 1, 2, 3. So when you analyze the data, so you will have to present that like this. For example, maternal mortality rate. This one shows the before status and this one shows the after status. So here you can see reduction. So you will have to analyze the data and present it like this in region 1, region 2, region 3, and similarly region F, region G. So when you present data like this, then you can see that in which region the maternal mortality rates after the intervention is reduced a lot, and which region it is still there are issues. So you can see here, analyze the data and present it in different ways to give some insights to the community and stakeholders related to the project. Another example in education. Evaluating an intervention Khyber Pakhtunkhwa or any other region, that is there is an education intervention and you are evaluating that. So here also your evaluation question is, what impacts has the intervention had on students' literacy rate? The project is based on education intervention increasing literacy rates. So your key question for evaluation would be, what impact has the intervention had on students' literacy rate? Indicator. Your key indicator would be literacy rate among children aged 6 to 12 and school attendance rates. These will be key indicators that you will collect data for. Data collection method, standardized tests. You will have to take tests from the student, attendance record, interviews with teachers and students. So these would be the data collection methods. Now the criteria when you are applying. So the first criteria that you would apply, relevance. So your question would be, are the educational intervention addressing the actual learning needs? Whether actually the literacy rate is very bad in that area, whether this intervention was required or not. Efficiency, are the educational resources being used optimally? Effectiveness, has there been an improvement in literacy rate or not? Coherence, how well does them integrate with existing educational policies? If there are educational policies on literacy improving, etc., so how well does this program integrate with those? Similarly, for impact, what long-term educational impacts are observed? And for sustainability, will the improvement in literacy rates continue after the intervention ends or not? So as we discussed, the key indicator, literacy rate, for example, so when you analyze the data, so you will have to show by year the literacy rate, and here with similar type of chart you can collect the data before 2020, the year when you are conducting evaluating, and then you can present the data of that current status, which is shown here on this bar. So you can present this data related to literacy rate like this. You can also present that literacy rate pre-intervention rates and post-intervention rates. For example, this blue one is the pre-intervention and the green one is the post-intervention. So you can present data school-wise or district-wise or region-wise. Similarly, attendance rate pre-intervention, what was the attendance rate, and now what is the attendance rate post-intervention? Now currently what is the attendance rate? You can show this by school, school A, school B, school C, or by areas, districts, location, etc. So here you can see, you can present it like this. The blue one shows the pre-intervention and the green one is after it. So there is improvement every year. You can present that and interpret this data. How to develop such type of chart? I have done lots of video tutorials, more than 100. Links are given in the description. You can watch those videos also. There are data analysis, need assessment, research, how to do data analysis of evaluation and research. So there are lots of video tutorial, and you can watch those videos. The links are given in the description, and you can visit my channel, and there is a complete playlist on data analysis. Now let me show you another example from WASH sector, evaluating a clean water project in Sindh or any other area, rural area or urban area. Your key question for this evaluation would be, has access to clean water improved in the target communities? You have implemented a project, clean water project. So your evaluation main question would be, has access to clean water improved in the target communities or not? Your indicator would be number of households with access to clean water, incidence of waterborne disease. These indicators will show you how effective this program was. Data collection method, household surveys you can conduct. You can ask the households whether they have access to clean drinking water or not, whether there are waterborne disease or not, water quality tests you can do, health clinics record you can see whether there is any reduction in health clinics record or not. Criteria is applied. Relevance. Is the project addressing the critical water needs of the community? Whether actually there was a problem related to water in that community. So whether the project is addressing the critical water need of the community. Then for efficiency, are resources being used effectively to provide clean water? Effectiveness, has access to clean water improved? Coherence, does the project intervention complement with other WASH initiatives of that area, of other NGOs or government initiatives? Similarly, impact, what long-term health improvements are linked to the project? And for sustainability, will the community continue to have access to clean water after the project ends? Now, infographic data. When you analyze the WASH sector data, impact of clean water access on community health, so you can then present data like this: diarrheal disease incidence, child mortality rate, average health care cost, school absenteeism. It's related to that WASH activities. So before you can collect a data before the clean water access and after clean water access, and you can then compare and present the data like this or in any other format. Or for example, water quality test results before and after project, so you can show these parameters which are related to the water testing, and then before project, after project, and what are the benchmark and standards. For example, you can add those also to show that this is the before project status, this is the after project status, and this is the WHO standard, whether it's meeting that standard or not. In the DRR sector, evaluating a disaster risk reduction in Balochistan or any other area, whether there is a disaster. So your key evaluation question here would be, how effective is the program in reducing vulnerability to floods? So indicator would be number of households with improved flood resilience, frequency of flood related damages. What was the status before and what is the status now? Whether the households have improved flood resilience, intervention implemented related to flood resilience, so whether there are these interventions. So you can then assess the number of households with improved flood resilience and frequency of flood related damages. If there is, God forbid, another flood, so whether there were same damages or there is any decrease in those damages. Data collection method: simply surveys, focus group discussion, field observation. Criteria apply. The number one, does DAM address the key disaster risk faced by the community? The actual needs of the community. For example, if they need some walls, so whether walls have been constructed or something else has been constructed. Efficiency, are the resources allocated in a way that maximize resilience? Effectiveness, has there been a reduction in flood related damage? Coherence, is the program aligned with national DRR strategies, PDMA, DDMA strategies? What long-term reductions in vulnerability are observed? And sustainability, are the resilience measures likely to be maintained over time? For example, if you have constructed some walls or other damage related infrastructure, so whether that is sustainable or not. And then you can present the data related to DRR like pre and post intervention flood damage. For example, these are some of the different categories. This is the metric, and before intervention, what was the cost of repairs? After intervention, what is the cost of repair? And then you can present here the change, the percent change. So you can number of buildings damaged after intervention. So you can present the data like this related to different DRR components. And humanitarian sector, emergencies, evaluating an emergency food distribution program in any area, Karachi or any other area. So here your evaluation question would be, how effective is the in alleviating the food insecurity? Number of households received food aid, reduction in malnutrition rates. These would be your key indicators. Data collection, beneficiary surveys, health assessment, distribution record. Your criteria apply. Relevance, is the food aid addressing the immediate nutritional need of the population. For example, you have provided food, so whether they actually required food or they needed some cash or other non-food items, etc. Efficiency, are resources being used to reach the maximum number of beneficiaries? Has there been a reduction in food insecurity? Coherence, how does the integrate with other relief efforts? Impact, what long-term improvement in nutritional status are observed? Sustainability, are there mechanisms in place to sustain food security post-crisis? So this is an example from humanitarian sector. And then you can present, for example, household receiving food aid. You can present that data for different months. Here you can see months and how much has been provided. And you can pre and post intervention malnutrition rates. You can present in a table like this. For example, before intervention is what, 25%, now it is 12%, and that is the change in each indicator. Evaluation is a powerful tool for enhancing project effectiveness, driving continuous improvement, and maximizing impact. By applying evaluation principles, strategies, and best practices, we can ensure the success of sustainability of our project. See you in the next video, part 4. In the part 4, we will discuss a case study demonstrating application of evaluation criteria in components for a multi-sectoral project. That we will do in part 4. In part 5 of the evaluation series, we will discuss practical steps, best practices, and strategies for effective evaluation. Similarly, in part 6, we will discuss challenges in evaluation and how to overcome those challenges. And then in part 7, we will discuss ethical consideration and evaluation. Also, already uploaded 2 video tutorials in this series. In this first one, we covered some foundational aspects of monitoring, evaluation, and research. And in the second one, we discussed monitoring in detail. If you have not watched these videos, so the links are given in the description. If you visit our channel, so you can find lots of video tutorial and playlists on monitoring, evaluation, and research. What is monitoring, how to do it, designing logical framework, result framework, theory of change. Similarly, we have playlists of Microsoft Excel learning data analysis function. So there are lots of tutorial on data analysis, how to do. There are lots of video tutorial on how to do online data collection with Kobo, MS Form, Google Forms, online data collection tools, Kobo. You can improve a lot of your skills through easy ways to collect online data and analyze that. Similarly, ChatGPT and other AI tools, MS Access, if you want to learn Microsoft Access, so there is a detailed tutorial on MS Access and SPSS, and similarly other tutorials that can benefit you a lot. We also provide one-on-one session if you are interested to learn about any of these topics. Here you can see the WhatsApp number or Skype ID, email address. You can contact us. We provide one-on-one sessions also that we can discuss through WhatsApp or email. Don't forget to subscribe, like, share with your family and friends, and hit the notification bell.